financial relationships with the planners and speakers have been mitigated. A link to the evaluation will be passed out and posted in the chat. If you are ABS certified and want NGHS to report your CME credits to the ABS, please fill out the evaluation and give us permission to do so. If you have a question for our presenter, please hold until the end of the talk. If you're attending virtually, feel free to enter your question into the Q&A section and we'll read it aloud. And now it is my pleasure to introduce our speaker for this morning. Dr. Virginia Jarvis is a first-generation physician from a small town in Eastern Virginia. Knowing from a young age that she wanted to pursue medicine, she started taking college classes while still in high school and graduated from the College of William and Mary at age 20. She then went on to receive a master's degree in biomedical sciences from Eastern Virginia Medical School, and she completed her medical degree at the West Virginia School of Osteopathic Medicine. Having grown up in a very small town with limited access to health care, she made the decision to pursue general surgery residency at a community program with the goal to provide care in those more rural areas. During residency, she found a passion for trauma and critical care. She is currently applying for fellowship in critical care, and she plans to practice as a trauma surgeon upon completion of her training. Please join me in welcoming Dr. Jarvis.
Thank you for that. I'm Virginia, and today I'm going to be talking to you about the history and evolution of women in medicine. I have no disclosures, and our learning objectives are as follows. We will discuss historical figures and how these have shaped the field of medicine. We'll review the milestones women have achieved within the field of medicine, and we'll speculate on continued progress on how to make these changes occur. In 300 BC, Accreditation was sentenced to death for practicing medicine without a man's identity. And in 2024, Beth Sutton became the 105th president of the American College of Surgeons. You may notice there's a pretty significant dichotomy between these two events. Today, I'm going to take you on a timeline spanning thousands of years to show the evolution that led us here, and I'm going to do this in several chapters. Chapter 1, Ancient and Medieval. In ancient Greece and Egypt, the field of midwifery was highly regarded, but it was deemed separate from the field of medicine, and women were confined to the field of obstetrics. Women were not considered equals to men, and they were not allowed to be considered practitioners of medicine. This was likely, at least in part, due to Aristotle's theories that women were fundamentally different and weaker than men. We've all heard of Aristotle even thousands of years after his death, so we can assume that his work was, unfortunately in this case, fairly influential. So how did we get from there to here, with a female surgeon talking to you all today? We'll start our journey through space and time around 300 BC in Athens, Greece, and this brings us to Accreditation. Accreditation is regarded in some circles as the first female physician in the world. The records from this time are, shall we say, sparse, but even so, the story of Accreditation remains an important one in the world of medicine. It's thought that Accreditation was drawn to medicine when she realized that many women were dying during childbirth. During these times, many women were hesitant to seek the help of a male physician due to modesty, so they were left with minimal care. This lack of equity drove Accreditation to cut off all her hair and disguise herself as a man so that she could pursue the field of medicine. Initially, her patients refused her assistance because they thought she was a man. But when she revealed herself as a woman to her female patients, her services suddenly became in high demand. The men of the town noticed that her services were more sought after than other physicians, and thinking she was a man, they accused her of seducing their wives, because how else could she be drumming up all this business? She was taken to court on these accusations, and when she revealed herself as a woman, she was sentenced to death for practicing medicine without the identity of a man. But there were many protests. The wives stated, "You are not husbands, but enemies, because you condemn her who discovered safety for us." This caused the law to be changed to allow women to practice medicine, making Athens the first Greek city to allow this under law. Now we'll skip forward about 500 years or so, but we'll stay in the same general area of ancient Greece, and we'll talk about Metrodora. Metrodora was an Egyptian-born and educated female physician who practiced in ancient Greece around 200 AD. In those days, Egyptian law that women were actually considered equals to men. so she was able to receive a medical education due to her Egyptian background. The Greeks believed that women were second-class citizens and that medicine should only be practiced by men because medicine was a divine science derived from the gods, and that really should be left up to the men. But luckily, Julius Caesar had ruled around 50 BC that women educated in medicine should also be allowed to practice. So Metrodora's Egyptian background gave her kind of a loophole for practicing medicine in Greece. Today, she's known as the mother of gynecology, and she's credited for being the first woman to author a medical textbook, which is pictured here. Her book, The Diseases and Cures of Women, outlines gynecological methods that are still used in practice today, including certain surgical methods and the use of the speculum. Given the lack of records from this time, her identity remains somewhat unclear, but her name literally translates to gift of the mother or gift of the womb. There were rumors that this was an alias for Cleopatra, and she became known by some as Cleopatra Metrodora, but we can only speculate. Around the 8th century, the Islamic Golden Age began in regions of Asia and Africa. This era was brought about by a movement of scholars to acquire all knowledge available. During this time, many female physicians existed, and they were allowed to treat both sexes, which was unusual for that time. In this era, midwifery became a well-respected field, and the study of diseases of women actually became a specialized branch of medicine. This era spanned about 5 centuries before there was a bit of a shift, but we'll get to that. Now we're reaching the Middle Ages, around the 1100s. This was a time when religion was an inherent part of most cultures, and women were taught that silence and humility were the only ways to honor God. It was highly unusual for women to receive any formal education. Women were typically only taught to read if they were born into wealthy families or if they lived in the convent, and domestic management and religious literacy were emphasized far more than higher education. This brings us to Hildegard of Bingen. Hildegard of Bingen, also known as Saint Hildegard, was a leader of community of nuns in Germany during the early to mid-1100s. An interesting fact about Hildegard was that she saw visions from a young age. Scholars today believe that her reported visions were actually auras from migraine, but at the time, visions were considered to be a gift from God and were highly valued. It's thought that her visionary gift allowed her to exercise her voice and opinion in the otherwise male-dominated Catholic Church. She began recording her visions in writing and produced many written works, and in the process wrote several medical texts. This was highly unusual in the times when women were largely excluded from higher education, but she was able to use her religious affiliations to bridge that gap. Around the same time, in the 1100s, a woman named Trotula was getting a medical education in Salerno, Italy. Salerno was the epicenter of medieval medicine in Europe, and it was famous for having the first medical school. Many women were actually trained as physicians here, during a time when women were denied education throughout most of Europe. Trotula attended this medical school, and she is now considered the world's first gynecologist. She was the first to propose that women use opiates produced by plants to dull the pain during childbirth. Prior to this, people believed that women should suffer the pain of childbirth due to the sin of Eve. So for any moms out there, you can thank Trotula for your epidural. She wrote many medical texts in her time, focusing primarily on the field of gynecology. This is around the time when things began to shift. While women were not actively encouraged to pursue higher education, they were not explicitly banned up until this point. As we discussed, there were female physicians and midwives throughout ancient Greece and in Europe in the early Middle Ages. They may not have had the same opportunities readily available as their male counterparts, but female physicians were not unheard of. But over time, the world of medicine in general became more exclusive, and it became almost impossible to practice medicine without a diploma from the University of Paris. Then, in 1325, Pope John XXII ordered a ban on midwifery and female practitioners, claiming that these women were practicing witchcraft. And by the mid-1500s, women were no longer allowed to study at universities. This brings us to Chapter 2, our modern exclusion era. We'll take a stop on our timeline in 1754 in Wittenberg, Germany. Dorothy Erxleben was the daughter of a physician who believed that women should have access to higher education. At that time, formal university was still off limits to women, so her father taught her privately and encouraged her intellectual ambitions, which was a very unusual feat in this society. She worked as an assistant in her father's medical practice, and during the time, she actually wrote a manuscript on the investigation of the causes keeping the female gender from studying. This was eventually able to be published after her father wrote a preface for her, of course. When her father died and left debts in his wake, she ran his medical practice on her own. She was eventually reported for treating patients without a medical license, but she fought for a special permit from the Prussian King Friedrich II to submit a dissertation at the medical faculty in Halle. She was able to officially achieve her medical degree in 1754, making her the first female physician in the more modern world. Keep in mind, this was still in the day and age where witchcraft and apothecaries were far more prevalent than educated physicians, and it was unheard of for women to move in the more academic circles. It was so rare, in fact, that it took over 100 years for the next woman in Germany to receive her medical degree in 1899. But we're skipping forward a little bit, so let's go back about 50 years and move to America, more specifically New York, in 1849. Here's a name you all might be a little bit more familiar with: Elizabeth Blackwell, the first woman to receive a medical degree in the United States. Elizabeth Blackwell was born in Bristol, England, but due to her father's goal to abolish slavery, the family moved to America when she was 11. Interestingly, her dream was not to become a physician. Actually, she was repulsed by the idea. In her book, Pioneer Work in Opening the Medical Profession to Women, she stated, "The very thought of dwelling on the physical structure of the body and its various ailments filled me with disgust." She did have a strong interest in history and metaphysics, so she decided to become a teacher, which was a very respectable field for a woman. Then one day, a close friend who was dying indicated to Elizabeth that she would have been spared her worst suffering if her physician had been a female. This is when she began to consider the pursuit of medicine. So what inspired Elizabeth to consider medicine was not a strong interest in biology or anatomy, and it was not a desire to physically care for the ill. Her inspiration drew from a desire to create equal opportunities for women in education, as well as to limit healthcare disparities for patients. But how do you become the first of anything? There's no template, no mentor to guide you, especially in this time when women were actively discouraged from pursuing these academic endeavors. People told her it was impossible, it was too expensive, those opportunities weren't available for a woman. Although she had every reason and excuse, she didn't let it dissuade her. She convinced 2 physician friends to let her study with them for a year, and she then applied to an abundance of medical schools within the Northeast. At one point, a mentor even suggested that she disguise herself as a man to gain admission, but she declined. When she applied to Geneva Medical College in New York, the faculty allowed the all-male student body to vote on her admission, assuming they would never allow a female to join them. The male student body actually thought it was a joke, so they voted yes. And she became the first female to be admitted to medical school out of pure misunderstanding. In 1849, she became the first woman in America to receive a medical degree, carving the path for all of the female physicians here today. We now celebrate National Women Physicians Day on February 3rd, which is the birthday of Elizabeth Blackwell. A year prior to Elizabeth Blackwell's graduation from medical school, a female medical school opened in 1848, known as the Boston Female Medical College. This may seem like significant progress was made when Dr. Blackwell was admitted to medical school. I mean, a whole women's school opened before she even graduated. That seems like a big move. But the reasoning behind the opening the school was not out of a progressive mindset. The founder of the school, Dr. Samuel Gregory, felt that it was unnatural for men to attend to women during childbirth. So his initial aim for the school was to create obstetricians so that men didn't have to be there during childbirth. Luckily, the school's teachings expanded beyond midwifery within a few years, and it became a true female medical college. In 1864, Rebecca Lee Crumpler became the first African-American woman to earn a medical degree. At that time, during the Civil War, may I point out, nearly all medical schools barred Black students, and only 0.55% of physicians were women at this time. Needless to say, she faced extreme barriers and battled racism and sexism throughout her career. The 3 women I've outlined in our modern exclusion era, Dorothy Ertzleben, Elizabeth Blackwell, and Rebecca Lee Crumpler, all became the first. They broke through systematic barriers that had been in place for centuries. And this didn't necessarily trigger an immediate societal change. It didn't break down the walls right away. But each one of them removed a brick from the wall, making it easier for future women to come along and take them down. This brings us to Chapter 3, Breaking Down the Wall. About 80 years later, in 1943, women were allowed to serve as military physicians for the first time in history. Prior to this, women could only contribute as contractors. But in the 1940s, the military ranks massively expanded, and the Army realized that they didn't have enough physicians to care for them. They decided they couldn't afford to miss out on the help that the female physicians were offering. Demand overrode preference, and women entered the ranks. I'd like to take a few stops along our timeline to include some pioneering women in the field of medicine, without whom modern medicine would not be the same. Dr. Helen Brooke Taussig studied histology, bacteriology, and anatomy at Harvard Medical School and Boston University in the 1920s, but she was denied a degree at both institutions because she was a woman. She eventually went on to publish a paper on ox heart muscles, and she was admitted into Johns Hopkins Medical School, where she received her medical degree in 1927. She was initially interested in the field of internal medicine for residency due to her interest in cardiology. But there was only one position available for a woman in internal medicine at that time, and it was given to someone else, so she turned to pediatrics. In the 1940s, Dr. Helen Brooke Taussig founded the field of pediatric cardiology. She closely studied what was then called blue baby syndrome and discovered that congenital heart defects were what caused 25% of deaths within the first year of life and 70% of deaths before age 10. She worked with surgeon Alfred Blaylock and lab supervisor Vivian Thomas to develop the first successful open heart surgery technique for children with congenital heart defects, known as the Blaylock-Taussig-Thomas shunt. Helen Taussig pioneered the procedure that allowed children with a previously fatal disease to live long, healthy lives, and she founded an entire field of medicine on providing these children with care. In 1965, she became the American Heart Association's first female president, a very well-deserved title. Another important woman to mention along our timeline is Virginia Apgar, an anesthesiologist with a focus on obstetrics and congenital birth defects. She attended Columbia for medical school in 1930, during a time when only 4.4% of physicians were women. She initially intended to become a surgeon, but she was advised to switch to anesthesiology due to limited career prospects for a woman in surgery. In 1949, she developed the Apgar scoring system. This is a systematic assessment of the health of a newborn that's used with every delivery, even today. The culmination of her work resulted in the development of the field of perinatology. Now, we can't talk about pioneering women in the field of medicine without mentioning our very own Dr. Priscilla Strom. We all know Dr. Strom as an incredible mentor and surgeon and our former program director. But what some might not know is that she was the very first female graduate of Emory's surgery residency in 1981. She then went on to complete a trauma fellowship in 1982, becoming the first female trauma surgeon from Emory. I had the pleasure of listening to a podcast episode entitled On Being the First by women in surgery at the Emory residencies, and I heard Dr. Strom talk about her incredible journey through the field of medicine. She used to tell us as residents that she went into surgery because it's the only specialty that you can't learn just by reading books, and I think that perfectly illustrates her desire to always learn and be the best version of herself. On the podcast, she talked about how she practiced in Bangladesh for years in various fields of medicine, but when she heard about the field of laparoscopy, she returned to the States so she could continue to learn those skills and stay ahead of the curve. This constant acquisition of knowledge is something that I witnessed when I was working with her, the way she stayed up to date on literature and practiced evidence-based medicine, and the way she never took her own expertise for granted. These are all qualities I aspire to have as a surgeon. We'll return to our timeline in 1990 to talk about Antonia Novello. Antonia Novello was appointed the first female Surgeon General in 1990, and as it happens, she also became the first Latina to fill the role at that time. During her time in office, she launched campaigns to promote childhood immunizations, combat tobacco ads targeting children, and increase awareness of domestic violence. So within the last 30 years, we've made pretty significant progress. Women have worked to break down barriers brick by brick. And what we find is that with each brick, it gets less daunting. The timeline speeds up and evolution happens faster because we have those who came before us to guide us. More women are entering the field of medicine in a wide variety of specialties. Antonia Novello showed us what it looks like to have women in leadership roles, and in 2005, Dr. Catherine Anderson became the first president of the American College of Surgeons. Since then, we've had 3 more women as presidents of the ACS, most recently Beth Sutton in 2024. We've had female presidents of many major societies at this point, including the American Association of Surgical Trauma, Eastern Association of Surgical Trauma, and the American Association of Thoracic Surgery, which, if you know anything about the percentage of women in the field of cardiothoracic surgery, you know this is a pretty incredible feat to head this association. This shows that we now have distributed leadership across many different fields, and we have more mentors to look up to. This seems to create a ripple effect. In 2017, we saw for the first time in history that women entering U.S. medical schools outnumbered men. So what does this mean for the future? Have we completely taken down the brick wall? Probably not yet, but we've made a lot of progress. What we can say for sure is that when we open the door just a little bit more, when we take down one single brick, we make way for more people to get through. And when we make just a little bit of room, we allow for a bigger collaboration of the minds, and we invite opportunities for progress. Just think, how many Helen Tossig level minds were turned away from programs that didn't want them? How many medical advancements were left out to dry because people weren't willing to listen? I think we can continue to improve in these areas because we can always improve on these areas. We can always be open-minded and willing to listen. We can always be inclusive to anyone willing to learn. And we can continue placing people in leadership positions based on qualifications without consideration of gender, race, or religion. And importantly, we can serve as mentors to those who come after us. This evolution paints a picture of many women who were told they can't do something, and instead of agreeing and walking away, or getting angry, or seeing life as unfair, they simply asked, well, why not? They faced challenges and adversity, and they used their experiences to pave the way for others. This mindset can apply to all of us, in life and in residency. There will always be challenges to overcome, and we can get upset with the challenges, or we can take them in stride and ask, why not? And I personally am so grateful to be here in this generation and in this hospital with colleagues and mentors who support me and offer equal opportunities. And I'm grateful for those who came before me and paved the way for me to be here today. It's not always easy, but it's always worth it. These are my sources, and thank you for listening.
Excellent talk, Dr. Jarvis. Thank you so much. Does anybody have a question or comment? Just raise your hand and I will bring the microphone to you.
Dr. Jarvis, congratulations. That was a very wonderful and informative talk. I'm interested to hear your thoughts on the incoming PGY1 class, that there will be 7 females in a class of 10. I think that shows the progress that certainly this program has made and programs nationwide. What challenges do you think we're going to see with women and how they're going to blend in?
I think it definitely shows progress. When I started, I was the only female in my class, so showing that we've really included more people and we've grown our female presence in the residency is huge progress. I think as far as challenges go, coming from a female perspective, it's always a bit of a bumpy road sometimes. There's always going to be patients who assume I'm a nurse. And I think that's always going to be the case. I think the more women representation that we have within the program and within medicine in general, I think that will continue to get better and improve.
And thank you so much, Dr. Jarvis. Excellent talk. Thank you.